Do you worry your teen is gaining weight quickly or seems hungry all the time? Are you afraid this could lead to prediabetes or diabetes later in life? That's why I created the Healthy Weight Starts with Healthy Habits, a 7-day hormone reset program for teens. In just 7 days, teens begin to understand their hunger signals, learn how to build meals that keep them full longer, improve their sleep habits, and feel more confident making healthy choices. Instead of guessing what to do, your teen will have a clear starting point and simple habits that support their metabolism and long-term health. You can learn more at lifestyleforteens.com/reset.
This is the Lifestyle and Weight Loss for Teens podcast. If you're a mom and want to help your child who is struggling to lose weight, you are in the right place. If you are looking for healthy lifestyle tips, Dr. Gourgari is here to help you understand the science around safe weight loss in teens and children. Because what works for adult weight loss is not always the best for children. This podcast is for educational purposes only. Dr. Gourgari does not provide medical, psychological, or nutrition therapy advice. You should not use this information to diagnose or treat any health problems without consulting your own medical practitioner. And now, your host, Dr. Jenny Gourgari.
Diabetes runs in your family. If you've watched a parent, a grandparent, or yourself gone down that road, and you're now watching your teenager's body start to follow the same path, I want you to know something. You're not being paranoid, you're paying attention. And you're ahead of most parents who don't ask questions until a doctor forces the conversations. Here's what most parents don't know. There are specific metabolic tests that are recommended for teenagers who are at elevated risk to develop diabetes. Teenagers that have family history of diabetes, teenagers that have excess weight gain, teenagers that have signs of insulin resistance, that their body is already under hormonal strain. These aren't just experimental blood tests. They are in the official guidelines. But not every family knows to ask for them, and those may not always get tested. Today, I'm going to walk you through exactly what these tests are, what the numbers mean, and how to have the conversations with your doctor. By the end of this video, you'll know exactly what to say at the next appointment, and you will be very well informed. That's exactly why I made this video, because knowing what to ask for changes everything. Let me start by validating something you probably already feel. Family history of diabetes is not just background information. It is a clinical risk factor that changes what we should be screening for and when should we be screening for. And here's why. Insulin resistance, the underlying driver of type 2 diabetes and prediabetes, develops gradually. It builds quietly over years before any blood sugar ever becomes abnormal. The pancreas compensates by producing more and more insulin to keep glucose in normal range. From the outside, everything looks fine. The labs look fine initially, your teen feels fine, but underneath, the system is already under strain. This is why the earlier we look for this, the more we can find, and the earlier we can intervene, the more we can do something about it. And we can reverse it. Now, here's something that most families don't hear, and it's very important, especially if your teenager is in the midst of puberty. Puberty itself causes insulin resistance. Researchers have measured it. We know this for a fact. During the pubertal transition, there is a decline of about 30% on insulin sensitivity. That is not because your teen is doing something necessarily in the way they eat or in the way they move, but this has to do with their hormones going high in puberty. And it's temporary. As puberty period ends, the body can recover and that can go back to normal. That is all normal. However, if you have a teenager who already has family history of diabetes and there is a genetic predisposition for type 2 diabetes, Then on top of that, they carry extra weight. Then on top of that, they don't sleep. Then on top of that, they don't eat well, they don't move. They have insulin resistance of puberty. That is a lot of strain to this pancreas. And that is why teenagers with family history can become more vulnerable during puberty. And that's why, unfortunately, we have started seeing teenagers in the United States have more abnormal prediabetes lab so early in their life. So there are guidelines now that tells us that teens and kids that are more than 10 years of age and who have extra weight defined as being overweight or in the obesity or have obesity, and they have risk factors like family history of type 2 diabetes, signs of insulin resistance in the body, which means like dark velvety skin change around the neck or under the arms, or if they have a diagnosis of PCOS in teenage girls, or if they have elevated blood pressure, or if there are certain ethnic groups like Blacks, for example, then they meet the criteria for screening. When does screening for prediabetes happen? It should happen after the age of 10 years or when puberty starts, whenever is earlier. And what are those tests that the doctors can order to see if there is any problem? One of the tests is fasting plasma glucose. So your teen doesn't eat anything overnight. Usually it's done after fasting for 8 to 10 hours, and it tests what is the sugar in the fasted state. It's very simple. It just gives you a snapshot of your sugar in the morning. Another test is called hemoglobin A1C. That test reflects what is the average blood sugar over the previous 3 months. And that tests how much sugar is attached to the red blood cells. And it's not just a snapshot of time. It's a better test because it gives you an average of what the average blood sugar has been in the last 3 months. The third test, which is a little harder to do, is called 2-hour oral glucose tolerance test, or OGTT. If you have been pregnant, you may have had this test. It's basically where they give you to drink sugar and water, a specific amount, and then they check the blood every half an hour over 2 hours, and then they look to see what is the blood sugar after 2 hours, after you drink that specific amount of sugar. Now, that is, as I said, a little more difficult to do because it's time consuming. And frankly, that liquid doesn't even taste that well. But it's also another third test that we recommend to screen teenagers at high risk for prediabetes and diabetes. What the numbers mean from this test. Let me explain what's the information you're gonna get from this blood test when you're looking for diabetes. For fasting glucose, normal level is below 100 milligram per deciliter. Between 100 and 125 is the prediabetes range. That's called impaired fasting glucose. When the blood sugar is 126 or above on two separate occasions, we talk about diabetes. When we're talking about hemoglobin A1C, a normal A1C is below 5.7. Between 5.7 and 6.4 is the pre-diabetes range. Above 6.5 is diabetes. And when we're talking about the oral glucose tolerance test, when you get a number below 140, that's normal. 140 to 149 is impaired glucose tolerance. And when it's 200 and above at 2 hours or at any point, that's diabetes. And now, very important, sometimes mistakes can happen. So if you get an abnormal result, especially if the teenager has no other signs, you need to repeat it because, it could be a mistake. Now, what's the first thing to do? Let's say after you got a diagnosis of those abnormal labs and you know that it is in the pre-diabetes range. That is where lifestyle modification is the most important thing. There is no reason to panic, and I want to tell you it is a reversible condition. Now, do everybody reverse? Not everybody takes the same action. It's not going to reverse if nothing gets done. And you can talk to a pediatric endocrinologist to give you an idea and a medical advice whether medications are indicated, because in some cases medications are indicated, and that's a decision you have to make between you and your doctor. But besides the medications, there's also lifestyle modifications that you can start right away. When we talk about lifestyle modifications, what are major simple things you can start doing, taking action steps right away? One thing is sleep. We know that the majority of teenagers do not get the recommended sleep, but sleep is particularly important for teenagers that are at metabolic risk for type 2 diabetes. Disrupted sleep that is not enough, less than 8 hours per night, can increase insulin resistance and can make prediabetes worse. So even if you add half an hour or 1 hour to the sleep every night, sustain over time, this can improve insulin sensitivity. This is very well documented, not only short sleep, but also inconsistent sleep timing. Both of those things have been associated with higher risk for insulin resistance. And I know it is very difficult to get a teenager to sleep more. And that is why I think teenagers need to be informed about the importance of sleep and what it means for their health. If you try to make them know you have to go to bed, it's not going to work if they don't really understand. But if it is a teenager that is motivated, they don't want to get insulin, they don't want to go that pathway, they want to decrease the risk for diabetes, then they may be more likely to take that action. Now, the second thing that you can start doing right away is make small changes to the diet. It doesn't have to be a diet about restriction. We don't want to eliminate carbs. Carbs are important for teenagers. We want to change the quality of the food. We want to have food that has less spikes of insulin, and that means having less refined carbohydrate, adding more fiber, more salad, and adding more fruits to the diet. And if you don't know where to start, I have created 30 recipes. They're free for teenagers that have high insulin resistance. You can grab it and start incorporating some of those recipes. Again, you don't have to change the diet 100%. You don't even have to follow all of those recipes, but making slowly changes, like start changing even 2 of those every week, that would be important. Start changing the breakfast and then the lunch, like making small changes to the diet every week that can help significant improvement in the insulin resistance and the higher risk for prediabetes later on. A third thing you can do is exercise. Now, exercise has to be fun so that teenagers love doing it and they continue doing it. Now, it doesn't have to be necessarily going to the gym, but it is recommended at least 150 minutes every week. Ideally, we want 1 hour of physical activity for every child. That is the recommendation. And if it's not necessarily intense activity, at least do some kind of activity, like a fun activity. Now, the risk that is there because of the family history of diabetes is not going to change. We know that it exists, we know that it's there. However, how you respond to it can change the trajectory, can change the path. Instead of going towards diabetes, to reverse it. Consistent effort is what matters, and you're not exaggerating. This is the time to intervene. You can change the trajectory. You can make small steps that can take huge results. And healthy hormones that act correctly, healthy hormones can make that path easier. And if you like that, please feel free to subscribe to my channel, share it with other friends and families, and I'll talk to you next week. Take care.
If you enjoyed listening to this podcast, I invite you to come check out the LIFT program. It's Dr. Gourgari's 12-week coaching program for teens and their moms, where we take all this information, we apply it to your daily life, and we work together so your teenager learns how to create a healthy lifestyle so they can feel happier, more confident, less stressed, and love their body again. Visit the website at lifestyleforteens.com and click on the Work With Me and free resources to learn more about this program and get free help to start this journey right away. Thanks for tuning in, and we'll catch you in the next episode of Lifestyle and Weight Loss for Teens.